Many men considering implants do their research and get concerned when they hear the term RTEs because there is not a lot of information about them. So let's talk about it. Hello again, I am Dr. Jonathan Clavell and I am a urologist, men's sexual health specialist, and penile implant expert located in Houston, Texas. Today, I want to spend some time to explain what the deal is with penile implants and RTEs. But before I start, I want to disclose that some of the information provided today is based on my personal experience and is not necessarily research-based. Also, every individual situation is different, so what I will provide today may not necessarily pertain to your specific situation. You should always discuss any concerns you have with your specific surgeon. And most importantly, if you are in the hands of a high volume implanter, you should trust that he or she has your best interests in mind and they will give you the best possible outcome. So now, let's get to it. RTEs is the acronym we use for the term rear tip extenders. To understand this concept, we first need to understand how the penis is measured during penile implant surgery. When we perform this surgery, be it from a penoscrotal, subcoronal, or infrapubic approach, we make a corporotomy, which is the term for when we open the corporal body in order to insert your cylinders. Then we dilate and then we measure. When it comes to your measurements, every male with a penis has two measurements, the proximal measurement and a distal measurement. Why is that? If you take a look at the anatomy of the penis here, you can appreciate that part of the penis is inside of your body. Let me repeat that. Part of your penis is inside of your body and not sticking out. The part that is inside is what we call proximal. Meanwhile, the portion of your penis that is on the outside is the distal portion. So when we measure your penis, the corporotomy is made and we measure the proximal portion and the distal portion, and then we add both of these numbers and that gives us your total length. Whatever the total length measures, that's what we put in. If your penis measured 22 centimeters in total length, we occupy the entire space of 22 centimeters. We cannot put in a larger implant because this can increase the risk of the implant eroding or sticking out of your penis, and we cannot put in something smaller because then the patient will end up undersized, which may cause what we call a floppy glans, which is a topic that we can discuss further in another video. Now, you already know that the total length of the penis varies for every individual. There are guys with longer penises and there are others with shorter penises. But what you may not know is that the difference between the proximal and distal measurements, or the proportion between these two measurements, also varies for everyone. There are guys in which 50% or half of the total length is inside the body, and there are others that's only about 30% of the penis. There are many factors that play into this disproportion in proximal and distal measurements, which include, but are not limited to, weight, body habitus, size of the scrotum, and penis elasticity. Let's take these guys right here, for example. The total length for all of them may be the same, let's say 22 centimeters. However, the difference between the proximal and distal measurements will vary. This guy on the far left that has a bigger belly, bigger thighs, is very likely to have a longer proximal measurement and a shorter distal measurement when compared to the guy at the far right who has a smaller belly, and therefore his penis may stick out more, making his distal measurement longer. In other words, both may be measuring 22 centimeters, but the measurements for the one on the left may be 14 centimeters proximal and 8 centimeters distal, while the one on the right may be 8 centimeters proximal and 14 centimeters distal. So what do we do there? Both will have a penile implant with a total length of 22 centimeters, but they will not necessarily have the same sized cylinders and RTEs. Let me explain further. Now that we understand that there are distal and proximal measurements, you may still wonder, what does this have to do with RTEs? If you didn't know, penile implant companies manufacture cylinders that come in specific sizes. For example, Boston Scientific's AMS 700 series cylinders come in increments of 3 centimeters, 15 centimeters, 18 centimeters, 21, and 24 centimeters. Meanwhile, Coloplast Titan cylinders come in increments of 2 centimeters all the way up to 28 centimeters. But what if you measure somewhere in between? For example, what if you're getting an AMS 700 implant and your penis measures 22.5 centimeters? They make an 18 centimeter, 21, and 24 centimeter cylinder, but your penis measures 22.5. This is where RTEs come in handy. For a penis that measures 22 and a half, we can use a 21 centimeter cylinder and occupy the rest of the space by adding 1.5 centimeters in RTEs. Let's take a closer look. Here's a Coloplast Titan cylinder, and these right here are the RTEs, which stand for rear tip extenders. As you can see, these are small caps that are placed on the tail end of the penile implant, and these are there only to occupy space, not to extend the penis. RTEs come in different lengths, and depending on the proportion of proximal to distal measurements, the surgeon may need to use these. On the other hand, this is an AMS device. The RTEs are also added at the tail end of the inflatable cylinder. These also look like small caps that are secured in place at the tail or most proximal end of the penile implant. You may have heard that we need to avoid RTEs, but that is only partially true. Let me repeat that. If you have heard that we need to avoid rear tip extenders, that is only mostly, but also partially true, because there are exceptions. The concept behind the need to avoid RTEs lies in the fact that RTEs do not inflate. They are only occupying space. A man who is getting a penile implant wants more of the inflatable cylinder rather than getting a bunch of RTEs, because less RTEs means the penis is more likely, but not necessarily, to have better axial rigidity, meaning the implant will be better anchored inside the body and therefore feel more rigid during sexual intercourse. As surgeons, we try to minimize rear tip extenders for this reason. We want to allow a man to have better axial rigidity. In order to minimize RTEs, most highly experienced penile implant surgeons try to make the proximal measurement as short as possible to allow us to provide you with a longer inflatable portion of the total implant and less of the rear tip extender. There are some tricks that we have up our sleeves to allow this to happen, but those we can discuss in a consultation. However, why did I say that the concept of avoiding RTEs is only partially true? Well, there are specific situations in which avoiding RTEs may not be possible. We need to understand that the cylinders and the pump in most locations come pre-connected, and depending on the size of the cylinders, the tubing between those cylinders and the pump have a specific length. Therefore, a guy who has a longer proximal measurement may need those RTEs in order to allow the pump to reach the scrotal sac and sit properly in the scrotum. Let's go back to our models for you to understand this. We have previously mentioned that all of these guys may have a penis with a total length of 22 centimeters, but based on their body habitus, their proximal and distal measurements are very likely to be different. The one on the left is likely to measure 14 centimeters proximal and 8 distal. The second one may be 12 proximal and 10 centimeters distal. The third one might likely be 10 centimeters proximal and 12 distal. And the guy on the far right may be 8 centimeters proximal and 14 distal. They all measure the same total length, but as you can see, the proportions may be different. And believe it or not, take a look here. All might get different sized cylinders, some with RTEs and some without. As you can see, the one on the left might get an 18 centimeter implant cylinder plus 4 centimeters of rear tip extender. Why? His proximal measurement is so long that if we put in a 22 centimeter cylinder, most of the length of the tubing going to the pump will be sucked inside his penis, and this will likely cause the pump to end up at the base of the penis instead of lower in his scrotum, which we call a high riding pump. A high riding pump that is not low enough for the patient to access will affect his functionality, because he may not be able to penetrate deep enough because the pump is blocking part of his penis, and this may also affect his access to reach the pump to allow him to cycle. So before you start judging his surgeon for adding 4 centimeters of RTE, you need to understand something. Given that most of his penis is deep inside his body, the fact that he gets 4 centimeter RTE does not necessarily mean that his penis is not well anchored. He measured 14 centimeters proximal, so despite him having 4 centimeters of RTE, he still has 10 centimeters of inflatable device anchored inside his body, which will provide him with plenty of rigidity, and his penis will not feel unstable during intercourse. And the tubing will also be long enough for him to be able to access the pump in his scrotum. Now, the guy on the far right got an inflatable implant without RTEs. For this one, given his proximal measurement was short, that was single digits at 8 centimeters, it is important that we avoid RTEs on him. Why? If we stack RTEs, his penis may not feel well anchored inside and would rather feel unstable while having sexual intercourse. These are all things that are determined inside the operating room. So asking your surgeon if he or she will use RTEs is likely futile. We can try to avoid rear tip extenders, but as you saw in this video, RTEs are sometimes necessary to give a patient the best possible outcome. What specific length and proportion between cylinders and RTEs you will get specifically will be determined in the operating room and not prior to your surgery. In summary, as surgeons, our goal is to create the perfect balance between functionality of the penis, that is, provide a man with a strong erection, cosmesis, or make it look as pleasing for you, accessibility, that is, allow the pump to be accessible for the man to use it, and reliability, minimize the risk of malfunction in the future. But remember, this is all a balance. In order to understand the concept of RTEs, we need to remember that the measurements of everyone's penis varies. Inflatable penile implants come in different specific standard sizes, and we need to take into account the patient's difference in proximal and distal measurements as well as their anatomy in order to decide what specific cylinder needs to be placed with or without RTEs. Another very important thing is that you need to trust your surgeon. Again, find a surgeon who you trust and has your best interests in mind. If you trust him or her, be confident that they will try their best to give you the best outcome possible. If you're getting your surgery with a high volume surgeon, that surgeon is very likely to know more about you as a patient regarding this concept. So make sure to trust your surgeon. Foremost, if this was a bit overwhelming for you, regardless if you're getting RTEs or not, remember one thing. The penile implant will likely provide you with a good, strong erection that will hopefully meet your expectations and allow you to enjoy a healthy sexual experience with your partner. Thank you for visiting our YouTube channel. If you enjoyed this video, make sure to hit the like button below and subscribe. See you next time, guys.